Health and Human Services to the United States Department of Justice. And that kind of collaboration includes the collaboration with you, our leaders on the ground. So with that, again, I thank you all, and I look forward to our discussion. And I will now turn it over to Julie Rodriguez.
Well, thank you so much, Madam Vice President, and I think we'll just get started. As you mentioned, we saw some tremendous action in Kansas, and so why don't we start with Representative Ruiz.
Thank you. Since being elected to the Kansas legislature, I and other pro-reproductive health legislators have blocked bills aimed at taking away reproductive rights. Unfortunately, we were unable to block bills placing the abortion amendment on the August primary ballot. As soon as the bill passed, many organizations formed a coalition named the Kansans for Constitutional Freedom. It felt great to be part of a movement of Kansans with a goal of defeating the amendment and sending a message to the next legislature that Kansans want to preserve their rights to make health care decisions. We especially reached out to the Latino community in the counties and cities where the largest concentration of Latinos live. Countless numbers of volunteers knocked on doors, placed signs in Spanish throughout the areas, and I believe this made a difference. The city of Liberal, Kansas, which is located in Seward County, has a majority Latino population. That county voted for the amendment, but they only won by 10 votes. On August 2nd, 2022, Kansas sent a clear message by defeating the amendment and showed the rest of the country how to defeat amendments in their own states.
Thank you so much, Representative Ruiz, for sharing that and for also emphasizing the tremendous coalition building efforts that you all have been doing on the ground there. Next, we'll go to Representative Romero from Utah.
Thank you, Julie. Hi, everyone. My name is Angela Romero, and I'm here representing Utah, but I'm also the president-elect of the National Hispanic Caucus of State Legislators, and our organization has been working with the Vice President and her staff, and such a privilege. I am thankful for the Vice President for taking a culturally sensitive approach to this complicated issue. Listening to Latina leaders who represent different ethnic and geographic rural and urban areas. In my case, I also want to point out that I'm Chicana, but I'm also Native American. We know that nationally, people who are already poor or middle class, many of those Latinas or Native Americans or Black, are denied, when they're denied an abortion, it shows a dramatic increase in unpaid bills, bankruptcy, and being evicted from their homes, all of which perpetuates the cycle of poverty. And we really talk about this as reproductive justice because we're talking about the social determinants of health. In Utah, many women, especially women of color, do not have access to even basic health care services and contraceptives. Women of color already have a much higher rate of maternal and infant mortality. Utah is one of the 13 states with trigger laws, and this will further compromise our health. We were lucky that Planned Parenthood and ACLU filed a lawsuit against the state of Utah, and they got a temporary suspension. We were able to put an injunction. So now, instead of the full ban on abortion, we just have an abortion 8-week pregnancy now. So after 18 weeks, you can no longer seek a legal abortion in Utah. All medical decisions, and I really want to emphasize this, including abortion, should be between a patient and their health care provider. I am sponsoring a bill to remove criminal penalties for those who provide abortion services or information. No one should have to fear prosecution for providing safe, scientifically sound medical information and services. And I really want to emphasize abortion is health care, and we have to continue to say that. Thank you.
Thank you.
Thank you so much, Representative Romero. Next, we'll go to Texas and Representative Hinojosa, who I know has been, at this issue for, many months as we saw Texas, be one of the first states to really take action.
Many years. This has
been
in the works
many years.
For years, but I appreciate the opportunity to share with Vice President Harris the concerns of my constituents, of fellow Texans who have been stripped of their right to make decisions about their bodies and their health care and their families.
Yeah.
I am Catholic, so I understand religious objections to abortion. But like many Catholics and like many Texans, I also understand that I can live my life of faith. I can practice my faith and live in a country that protects the rights of all Americans to practice their own faith, to make decisions about their bodies and their families. Governor Abbott and Republican legislators forced this extreme abortion ban on Texans and made no exception for rape or incest. And we have already seen an 11-year-old child, an 11-year-old girl in elementary school have to flee her home, flee her state to seek an abortion out of state. They made no exception for a non-viable fetus, a fetus that will not live. So this is not about life. This is about a government takeover of our bodies and our families. What's happened in Texas is that my constituents in Austin have to travel as far as Kansas to access the closest abortion clinic. It's 500 miles. I had to look at a map when I saw that data point. 500 miles to access the closest abortion clinic. We know many cannot make that trip. We also know that Republican leaders in Texas have vowed to come back in 2023 and ban that type of essential travel. And in Texas, we value freedom and we value families above all else. And no government law should enter a woman's body or any person's body. And no government should stand in the place of the individual to make decisions about our bodies, our lives, and our families. And I want to thank you for sitting down with us and exploring all creative legal solutions to protect the rights of women and the rights of Americans. Thank you.
Thank you, Representative Hinojosa. Next, we'll go to Representative Hernandez from Arizona.
Hello and good afternoon. Buenas tardes. My name is Alma Hernandez and I'm from the great state of Arizona. And I am very proud to be Latina and also Jewish. So I very much also believe that this is not an issue about religion as much as it is an issue about giving women the right to choose. In the state of Arizona, serving in the legislature, it's been very difficult because we are a state, one of the states that's the most restrictive when it comes to abortion and access to abortions. We have a law that was put into place since before Arizona even became a state. It's an archaic law from the 19th centuries, and it's caused a lot of confusion within our state. It has caused, we only have 10 providers in the state of Arizona, and that is not enough. I represent a community that is mainly Hispanic, and I also represent a Native community, a tribal area. So it's very important for us in rural Arizona to have access to healthcare, because this is healthcare. And we need to leverage and work with organizations like NHCSL so that we can all partner to be able to give women the access that they need for these services. As I said, it's been very confusing in Arizona. Planned Parenthood has officially stopped providing services. Now there's only one provider in Tucson. You have to travel. If you're from the border communities or other areas, you have to travel. And we see that the women who are most affected are the women of color and low-income families. If you can't travel, then you can't have the abortion. And that makes it very difficult. So as a public health professional, I want to partner and work with all of you so that we can provide these services for all the women in our communities. So thank you.
Thank you.
Thank you so much, Representative Hernandez. And next, I believe we'll go to Representative, sorry. Yeah. Oh, sorry. We'll go to Representative Gonzalez Rojas from New York.
Thank you. First off, thank you, Madam Vice President, for convening us. This is such a powerful group and a powerful dialogue. I'm New York State Assembly Member Jessica Gonzalez Rojas. I use she, her, ella pronouns. Like you, Vice President, I am a proud daughter of an immigrant. And actually for 13 years, I ran the National Latina Institute for Reproductive Justice. So this is very close to my heart. Since the overturning of Roe, it is estimated that New York State can see up to 280,000 people of reproductive age from neighboring states. And I've been talking to abortion providers around the state on the ground, and they have shared that their clinics are already backed up since the leak of the decision, and that procedures are being pushed out later and later, and that's delaying urgent care. I just talked to our abortion fund that shared that they have raised, they have pledged over $700,000 just in this few months to cover the cost of travel for people coming from 15 states around the country, and the largest two were Texas and Ohio. We're hearing reports of hostile presence at the clinics in some parts of our state, even in New York. We are understanding that pregnant immigrants, Latinas, and other people of color are citing the lack of funding for travel, the fear of criminalization and deportation as barriers to traveling across state lines in order to come to a state like New York to get abortion care. So that's why me in the New York State Legislature, I introduced the Reproductive Freedom and Equity Fund Act. It would provide resources, much needed resources to our clinics to ensure that we can provide capacity and care for everybody, and also to provide practical support that people need in order to get to New York. So I'm thrilled to share and have this discussion, and I thank you for your partnership and your leadership.
Thank you.
Thank you so much, Representative. We'll now go to Representative Villanueva in Illinois, that I know is serving as sort of a safe haven, especially in the area throughout the Midwest, given the restrictions on abortion access that we've seen.
Madam Vice President, it's an honor to be here. As the daughter of Mexican immigrant parents, would have never thought in my wildest dreams that this is where I would be, so thank you. To be here with my fellow Latina legislators from across the country. I'm Illinois State Senator Selena Villanueva, and like many of my colleagues before, I'm completely disheartened by this attack on women, by this war on women taking place in our country. I am proud to be from Illinois, a state that protects women's access to care. In 2019, as a freshman lawmaker in the House, I was heavily involved in the passage of the Reproductive Health Act, which gives each person in Illinois a fundamental right to make individual decisions about their own reproductive health. Today, Illinois is one of the most protective states in the country when it comes to reproductive health. It was important for me as a young Latina and as the state senator of the most Latino state Senate district in the state of Illinois to ensure that the rights of all women, including Illinois Latinas, were protected, and that we increase access to affordable care in our state so that nobody would be without an option. In Illinois, we are a safe haven for women regardless of income or zip code. Prior to the decision on Roe, patients were able to schedule an appointment in about 3 to 4 days. But now the wait times are about 3 to 4 weeks. And we do have patients coming from as far as Texas to the state of Illinois seeking abortion services. The amount of need that we are seeing from our providers is enormous. Because not only do we serve as a safe haven for the Midwest and for the states adjacent to us, we are now serving even further than that. I'm committed to working with my colleagues here and my colleagues back at home to ensuring that women have a right to choose. I'll continue to do it in Illinois, and I think we're going to continue to fight to make sure that we make this happen across the country. Thank you.
Thank you.
Wonderful. And finally, we'll hear from Representative Torres from Nevada.
Thank you, and thank you, Madam Vice President, for having us here today to have this critical conversation. And never in a million years would I have thought that my mother and her mother had to fight for abortion access. Now we are once again fighting for abortion access, and my niece might have to fight for abortion access too. So it's an issue that's really prudent for our communities. As a representative of the state of Nevada, our people voted in support of our right to abortion until 24 weeks and beyond, before I was even born. If the pregnant person's health is at risk, they had just as much access as anyone else. These laws means that Latinas like me have full control over their bodies and their futures. In the state of Nevada, we actually passed the Trust Nevada Women Act in 2019, which I was proud to support, which guaranteed that women had access to abortion without parental consent, and it removed the criminal penalties that would have been in place upon this decision had we not taken that legislative action and had that foresight in 2019. We're working to protect women from other states to ensure that they have access to comprehensive reproductive health care, regardless of whether they're a Nevadan or not. Nevada will not assist other states who wish to criminalize or punish people for receiving, assisting, or providing reproductive health care. And we will protect the licenses of our healthcare professionals from punitive actions taken against them in other states. The governor has done this by executive order, but state legislators continue to be committed to these efforts, and it's critical that when we return to Carson City this February, we take legislative action. Of the 10 states with the highest percentage of the Hispanic population, Nevada is one of 5 states that do not provide comprehensive reproductive health coverage through Medicaid. This is extremely important, and it's important that we legislate equitable access to reproductive health care for Nevadans on Medicaid. As a teacher, I understand just how important culturally competent care is essential. Language access is key, and so is bilingual health education. Too many families have come to me asking for support because they don't understand the medical documents that they're receiving when they're in the doctor's offices. And translation services are sometimes not available.
Right.
As a Latina and a Pacific Islander woman, I've been the victim of medical bias. I've been in the emergency room when doctors didn't take my treatment seriously as they should have. They made inappropriate comments and they left me uncomfortable at an vulnerable point in my life. That shouldn't happen to anybody. Abortion access is healthcare. And it's important that we take the correct steps as state legislators, but we need your support.
Thank you.
Thank you so much, representatives. So I think we'll sort of conclude this portion and move into our closed press portion of this and really dig into, I think, some of the realities of what you all are seeing on the ground. So thank you all.